I'm going to roll through some housekeeping items. Again, today is the rollout for the Molina Healthcare Marketplace preview. And by all means, if you have a question, you want to put it in the question box. We'll get to them at the end of the presentation. And my colleague, Eric Pouncey, is a broker specialist, as am I. And by all means, if you have any questions about the individual market, reach out to us. Eric's specialty is more on the technology side, and he'll get you set up for the marketplace and Health Sherpa and other concerns. Okay, there's my information, email, phone number, etc. We're just in a little holding pattern here. Kahassai is getting his slide deck together, and I'm just rolling through a few items here. He'll be here in a second. And I want to point out, in an effort to make more exclusive to Cornerstone brokers, we have put a little lockdown on our resource center. It's not a big issue. We just had to do this for PHI reasons and whatnot, but it's still easy to access. You want to contact me, or you want to contact our resource center administrator, Jess Larkin, and we can get you access. You can also go to www.crnstone.com to get started and create your username and password there. So this is news about the Resource Center. We're going to house a lot of the webinars and other information out there. Okay. And as an ASP broker at Cornerstone, you have an access to expert services. ASP stands for the Agency Services Program. We can help you with business outside your scope and planning for the future. We create a customized plan based on your specific needs to ensure that you and your business and your family are covered. Please contact us today. There is the information. And you'll go to the website and log into the Agency Services Program. I appreciate everybody's patience. We're going to rock and roll. We're going to get through this in about 30 minutes or so. And thank you so much, Kahassai. Take it away.
Okay, perfect. Thank you. And I'm trying to, just give me 1 second. It's trying to get rid of this thing that's blocking my screen. I don't know what happens if I close it. I don't want to close it. Okay, here we go. There we go. Perfect. Hey, fellas, thank you so much for the opportunity to go over the Molina 2023 marketplace product line for this year. And apology again for the slight delay here. Let's jump on this. Thanks, Geoff, as well for the opportunity.
You bet, you bet. And guys, if you have any issues with your sound or you're having any issues on your end, just if you're able to send something in the question box, we'll get those remedied as well. Thank you.
All right. So my name is Kahassai Tafese. Many of you are probably familiar with me. I've been around with Molina for quite a number of years. Many of you also refer to me as KT, which is completely acceptable. My cell phone number or my email address is here for you. At the end of this presentation, I'll be sure to send a copy of this to Geoff, which I'm sure will be sent out to every one of you, so you have a copy for your own record and reference. Just to go over, I do represent Molina Healthcare in Ohio, Kentucky, and West Michigan. I will be covering those 3 states this morning and answer questions that you may have specifically. Before we begin, just a reminder, open enrollment begins November 1st, 2022, and it goes and is now official January 15, 2023. Very important. I want to make sure that you are ready to sell. How do you know that you are RTS with Molina? If you are currently appointed with Molina, all you need to do is make sure that you have completed EFFM certification. If you sell in any state-based market, such as Kentucky, Idaho, California, Washington State, you want to make sure that you have the state-specific certification. You do not need to send a copy. We will automatically be able to get access to that through the FFM or the SPM market. Also, make sure that you have an updated errors and omission. Now, you also do not, if you're currently appointed, you do not need to send that, a copy of that. We also want to make sure that you have your insurance license, both resident and non-resident licenses, all renewed and up to date. And want to make sure that you are fully appointed with Molina, and you could do that by checking into the Molina broker portal. It will, you will be able to check your status as RTS. If you are currently not appointed with Molina and you are wanting to be appointed with Molina for the first time, you want to reach out to Cornerstone to get a link to their contract with Molina. You would follow that link to complete an application. Make sure that you upload your FFM certification or state-based market certification, your E&O insurance license, both resident and non-resident. You want to make sure you check every state where you intend to sell. If you do not intend to sell in any of the 14 states, do not check the states that you're not wanting to be appointed in. Once you complete the application, then your application will need to be approved by Cornerstone. And from that point, it comes to the Molina backend process. It's an automated process in which we do search your background, and it takes a couple of weeks and sometimes longer, depending what state and how many state you are requesting to be appointed in. And then I say that please do not submit any application prior to receiving a welcome email from Molina authorizing you to sell with your unique Molina agent code. If you do, you will not get paid. So just wait until you get your authorization letter from Molina. Okay, here's our national footprint. We're not pulling out of any states this year. We're going to remain in all of our 14 marketplace states as listed here, and we will be expanding. The only state where we'll be expanding is in Michigan to 2 additional counties. I'll give you the details in the next few slides here. And we will be withdrawing from 1 small county in Ohio, namely Tuscarora County. Very small, and that's due to network inadequacy. Okay, so total 14 states, 344 counties, and all 14 states combined. Okay, well, I had this set up where we began with Michigan, so I'll start with Michigan. Typically, I would have switched it to Ohio first, but again, we're in 2 corners of Michigan, on the eastern portion and the Wayne County, the Detroit market. We're expanding into Genesee County. We will also onboard Genesee Hospital in that area, which is really important. And then the second area is the Grand Rapids or Lake County area. We're expanding into Lake County. So bringing our total counties in the state of Michigan to 70. Okay. This is a highlight of the Molina of Michigan network. And in the Kent County area, the Grand Rapids, we have pretty much all of the hospital systems: Metro Health System, Spectrum, and the Mercy Health System. Oakland and Macomb, these are closer to the Metro Detroit area. We have the Beaumont, Henry Ford, specifically the Kenwood Hospital, and the Bloomfield Hospital. So as you can see, it's based on Beaumont Health System predominantly, but we do have additional hospital systems in the area, as you can see listed here. You will have a copy of this. All right, Ohio. So again, remaining in 63 counties, pulling out of Tuscarora County. So where you see highlighted in blue is where we are for marketplace, and the gray area is where we are for Medicaid and Medicare. So we're pretty much in the entire state as far as Medicaid and Medicare is concerned. Our network will continue to be the same. So in Cuyahoga County, the Metro Health System in the Cleveland area, mostly, and Southwest General Hospital. In Franklin County, will remain with the Ohio State University Medical Center. James Cancer. Hamilton County, it will be the Kettering Health System, the Mercy Health System, and University of Cincinnati. Now, one thing to note is that Molina does not limit our members to network only in their county. Our members have access to our entire statewide network. So someone living in, say, southeastern Ohio and Portsmouth has access to Ohio State University and the James Cancer Hospital. Someone living in anywhere can have access to the Hamilton County Hospital. So our members are not locked in to a specific network or county-based network. In addition to hospitals in Ohio, we also have networks in Kentucky, mainly King Star Hospital out of Ashland, Kentucky, which also has hospital systems inside Ohio, and also hospitals listed here on the right. These are the West Virginia hospitals that are available to our members living on the border of Ohio and West Virginia. Okay, so again, our Molina members are not required to have a referral to see a specialist. They can self-refer. They can also certainly go to any in-network hospital or provider. Okay, Kentucky. I'm going to go to products, but I'll go over the market area. So you may be aware, we did purchase this passport system in Kentucky. So Molina Passport Health Plan is going to be rebranded, and it's now going to be called Molina Passport by Molina Healthcare. So this is just telling you to look out for some of these changes. We'll be sending additional emails to inform you of this as well. Okay, here's where we are in Kentucky, mainly in 3 counties in and around the Louisville area and Lexington area. These are the only 3 counties that we'll be in. We entered this market last year and will remain in those 3 counties, no expansion. Kentucky is a state-based market. I know it's really tough to enroll individuals, and that's been a challenge for many of you in Kentucky, where it's taking much longer to complete an application. And when you do run across a problem, an issue, you are having to wait on hold for hours to get resolution. Has been obviously a barrier to enrolling more people. Unfortunately, we weren't able to make a planned option with Health Sherpa to provide to use Sherpa specific for this state-based, Kentucky-based enrollment. We were working on it, but we didn't get to it this year. We are working on it. Hopefully, that's a future something to look for, where Health Sherpa is going to come up with something with the approval of the state of Kentucky that, you know, instead of using the Connect to state-based to enroll, you can use Health Sherpa to enroll, and I think it's going to help out a great deal. Our network in Kentucky is going to be based on 2 major hospital systems, the University of Louisville and Norton Hospital System, and definitely sufficient, adequate for the service areas that we're in. Product highlights here. So in 2022, we introduced My Health Perks wellness program for members, where they earn $50 incentive for completing an HRA and a health assessment. This was very well received, and there's no cost to participating. Anyone 18 and over on any Molina plans can certainly participate in this. So we'll continue to have no cost 24/7 nurses advice line, no cost 24/7 teledoc virtual care services, no cost annual wellness exam, no cost preventative prescription drugs, no cost preventative screenings for children and adults, and no cost pediatric vision services. This is for anyone under the age of 19. The pediatric vision is serviced by VSP, and we allow our members to have an annual free exam, their free glasses or frames, as well as contact lenses if they wish to have contact lenses instead. Now, the allowance for it is $165, and if members choose to buy more expensive, they will have to pay the difference. California specific, I'm not going to go into that, but there is no pediatric dental services in the cost as well. So we're going to have two options as far as the plans are concerned for adult vision. We're going to have plans that do not give you access to adult vision, and we'll have plans that will have that members can buy the adult vision at additional cost. Right. This is an overview for our FFM offerings as far as metal plans that we'll be offering 2023 versus the 2022. As you can see, we will be discontinuing the Silver 2, Silver 4, and Silver 7. These members are going to be migrated to the Silver 1 or the Silver 1 with Vision, depending on what they had in 2022. In addition, we'll be offering in all FFM states the CMS Standard Silver 8. This is a CMS Standard plan, and I'm going to give you a cross comparison of the Molina Silver 1 versus the Silver 8. There are going to be variations and options within those plans. And the state-based Silver, Kentucky and Idaho, also will be discontinuing Silver 2, Silver 4, and Silver 7. And we'll continue to renew Silver 1 and 1 with Vision. In the state-based market in Kentucky, we will offer a CMS Standard Silver 11 silver plan. That's going to be a new CMS Standard plan in Kentucky. Okay, so if we look across the plans that we'll be offering, I'm going to go over a few of the highlights here. So we have two sections. So you have the Molina Constant Care Silver 1, which is the renewal offering. And then we'll have the Constant Care Silver 8, which is the CMS Standard offering. In each category, we're going to have the 100 all the way through 250. These are the CSR plans, which correlate to the federal poverty level. Okay. For our comparison services purposes, let me compare the Molina Silver 100 to the Molina Silver, to the CMS Standard Silver option. Where you see highlighted in green is where we waive deductibles. So we look at the deductibles for the Silver 100. On both of these, there is no medical deductible. The out-of-pocket max range between $1,400 versus $1,700. Our deductible is going to remain at 0 for both, except for the CMS Standard. It's going to have combines medical and RX deductible, but since there is no medical deductible, again, that's going to be 0. Co-insurance is going to be 25%. Same thing on the CMS Standard plan. And for ER services across the board on the Molina plans, it's going to be based on copay, which range between $350 to $950, whereas with the CMS Standard plan, it's going to be 25% co-insurance. Inpatient, there is a $600 per day, which is capped at a maximum 2 copays per occurrence. So if someone was to be admitted into an inpatient setting for 5 days, they're only responsible for 2 copays. The rest of their stay, they will not have to pay any additional copay. Now, if they were to be released and readmitted, they will incur additional copay until they hit their out-of-pocket max, which is $1,400 on the first one here. So, and on the CMS Standard, it's going to be 25% co-insurance. Primary care and urgent care is going to be at the same level. So 0 and across all plans, including CMS Standards. This is going to be based on copay all the way from 0 on the 100 to $30 and $40 as you go higher on the CMS plan on the 250. Okay. Mental health services as well. Specialists can be accessed based on copay. So our members can access any specialist services basically merely by paying a copay across all plans, including the CMS Standard plans. Imaging and specialized scanning on the CMS Standard plan is going to be on the Molina 100. It's going to be based on co-insurance, which is 25%, and it increases as you go higher on the CSR plans, 30% all the way to 50% co-insurance after deductible. Whereas you do not need to meet deductibles on the 100 CMS, and the 100 Molina standard plan, renewal plan. Okay. OT and PT across all plans is going to be based on copay. It can range anywhere from $10 to $40. Labs on the Molina plans is going to be based on copay across the board. For labs and X-ray diagnostics and outpatient facility is all going to be based on a copay. Okay. When we go to the drug prescription drugs, tiers 1 and 2, which are preferred brands and generics across all plans, is going to be based on copay. Deductibles are waived across all plans on these. Whereas for tiers 3 and 4, these are non-preferred and drug plans and specialty. These are going to be based on copay for the Molina Standard 100. However, it goes from 30% coinsurance deductible after deductible to 30% to 50% on the rest of them here. As you move on to the CMS standard plan, it is going to be on the $150, $60, $80 after deductibles to the $100, $250 CMS standard plan. The Molina renewal plans will offer adult vision option. However, no adult vision option will be available with the CMS standard plan. Across all Molina plans, there is going to be no cost or no charge telehealth or teledoc option, which is no limit, unlimited access to telehealth. Okay. For Kentucky, slightly different plan design here. This is the CMS standard plan. Again, the standard ones we just went over, but for the Silver 11, which is unique to Kentucky, deductible, again, this on this CMS plan is going to be 0 on the 100, all the way to 800, and then it increases to $5,700 and $5,800 on the 200 and 250. It does come out of pocket max, also does increase starting at $1,675 all the way to $8,900 as you get to the 250. It does combine RX and medical deductible. So when you hit your medical deductibles, you pretty much hit your RX deductible. Where you see highlighted in green is also services that can be accessed strictly based on copay, and deductibles are waived. Otherwise, there will be deductible after the 30% coinsurance on the rest of these. Similarly, on the drugs tier 1 and 2, no deductibles across all plans here. And tiers 3 and 4 on the 100, again, can be accessed strictly based on copay. However, as you go from the 150 to the 250, there will be 30% coinsurance after deductible and 40% coinsurance after deductible. Teledoc or telehealth will be free of charge, unlimited access, and no adult visions will be available on the CMS standard plan. Now, our target demographic is really primarily the silver option. Molina is not offering any options in these states. The gold option is a regulatory requirement that we must offer, and we will renew the Confident Care Gold 1 and offer a Confident Care Gold 8, which will be the CMS standard Molina Gold. As you can see here, the deductible is $1,900 versus $200 on the CMS standard plan. The out-of-pocket max is high on this, $9,100 versus $8,700 on the CMS standard plan. And it does combine the RX, embed the RX and medical deductibles. And where you see highlighted for PCP, urgent care, specialist, and mental health, these can be accessed strictly based on copay, which can range between $20 to $60, depending on the plan of selection. For imaging, it's going to be 25% coinsurance after deductible. However, for speech, OT and PT and laboratory is going to be based on copay on the Molina Gold versus the CMS standard only on the speech and OT and PT, and the rest of them will be based on coinsurance after deductible, 25%. Tiers 1 and 2, 15 and 50, and on the CMS standard plan across all tiers, they could be accessed strictly based on copay, which can range between $15 to $250. Telehealth is free of charge on both plans. There will be no adult vision options available with the CMS standard gold option. However, with the Molina option, you will have an adult vision option. Again, this was kicked off last year, the My Health Perks. It was received very well. It's available in all 15 markets. Please encourage your clients to upload their My Molina portal. This can only be accessed via web. This wellness program does include information and guidance, and it rewards members $50 for completing a combination of HRA and wellness exam combined. It supports risk adjustment through utilization data, identify potential gaps, and anyone 18 and over is eligible to participate. Again, this will help members manage asthma, heart disease, various chronic health conditions. And anyone who participates and completes is eligible for $50 financial incentive, which could be received via either a physical or a digital gift card. Molina member ID, we haven't made change, but for those of you that may not have been with us last year, just to go over a few points here. Molina's member ID does not contain your primary care. We don't list a PCP on the Molina card, and there's a reason for that. I'll go over it. We do highlight the deductibles and RX deductible, medical deductible, as well as the annual out-of-pocket max. We also do list your drug tierings 1 and 2, and list the member's full name, subscriber ID, and which plan they're in. The reason we don't list a primary care physician, even though we do require that members select a primary care physician at the point of enrollment, if they do, they will be assigned to that member, to that provider. If they don't choose a primary care physician, Molina will assign them, but members will not know unless they fully read the information that we send them, the welcome packet that we send them, which actually does list who their primary care physician is. Our members are allowed to go to any in-network primary care physician. That's the most important thing. As long as they stay in-network, they can maintain the same member ID card. We don't need to send them out a new card. And based on claims history, if a member is going to a different primary care physician than the one assigned, we will make that adjustment on the back end and send out a communication to the member, letting them know, hey, we see that you're going to a different primary care physician based on versus the one that we assigned you. Please continue to see the same PCP as we have made that adjustment for you. Our pharmacy vendor is going to be CVS Caremark. Molina does have a mail order pharmacy option for our members, in which they can obtain 90-day supplies at 2.5 times the copay. Right, this was updated last year. This is something that we Molina Online provided directory. This is identical to what United Healthcare uses. It's much nicer than what we had. When I send a copy of this, you'll have a hyperlink that is listed here that's going to take you directly to this site. You may also access this through molinamarketplace.com, and really an easy way to search by name, by city, by zip code, and by specialty, or even by hospital or facility. Now, it does let you know whether or not that provider is accepting new patient. Very important that you select, since we have 3 lines of business, that you select the plan or program up here by selecting Molina Marketplace. You don't want to pull the wrong network, because the Molina Medicaid and Medicare is completely different. Also, make sure you select the correct state and areas that you're looking for to be able to pull the correct network. Okay, these are the Molina self-service tools is a great option for members to have, because it really gives them access to so much information. Definitely, we're asking for your help to push members to be able to upload some of the mobile app and be able to utilize the benefits provided here. They are able to upload their member ID card. They're able to switch their primary care physician, and do a lot more and have access to their health information. Okay. When you complete an application using Health Sherpa, it's going to take you directly to our payment system if you choose to pay at that point, at the point of enrollment. You're able to go to this is what it looks like, and you may use any major credit card, debit card, EFT to complete payment information. If you choose to make just only one payment, you could do that. You may also click on both of these options here where you can set up recurring payments for that member, and that payment information is going to be saved. And Molina will collect payment on a monthly basis for the auto pay that's been authorized for your client. In addition to the auto pay, Molina also makes available additional payment options. Members can always log into the Molina payment system, and all they need is the last 4 digits of their social security number, the primary person's date of birth, zip code, and an email address so that you receive a confirmation of payment. And you can do this on a month-to-month basis. You may also set up pay by bill pay, pay by mail, just allow 15 days for receipt and processing. They may also pay by walking into any local MoneyGram locations in cash. They may also pay by phone by calling the Molina hotline. The Molina mobile app has been redesigned, so at the surface it will show the member whether or not they're covered or not. So on the surface, it will help them track their spending, how far they are to meeting their deductible. One new thing that we've added is that they're able to retrieve their 1095 tax form directly from this site. They don't have to wait for healthcare.gov to mail them a copy. They can retrieve a copy directly from here. In addition, they can look at billing, their coverage, pull their member ID card, look up their doctors. So quite a number of convenient options here for them to have full control of their membership with Molina. Our website was redesigned last year, so it looks more like the bottom portion here, which is going to list the entire plans available, not only the ones we'll offer in 2023, but side by side, you can compare 2022 versus 2023. Here, you'll be able to look up drugs, to retrieve the summary of benefits and various brochures and evidence of coverage as well. This will also take you directly to the view, the broker portal, if you want to access it directly from here. Okay. Renewal. If you do nothing with your renewal, we will be sending out communications to members. We will be mapping them to something closer to what they had, and that communication is going to be sent out to members directly. If you choose to actively renew your policies, which I think is going to be a good idea due to some of the changes being implemented this year, definitely you can do that starting October 1st. All of your book of business will be ready for renewal in view starting October 1st. Okay, formal renewal communication will be sent with inclusion a member-friendly cover letter promoting Molina value of being member, and also documents will contain details, premium changes, and your over-year benefit changes to that member. During the actual open enrollment period, 2 additional renewal communications are going to be sent. 1 in November and 1 additional final in early December. This is the view now. Some of you, well, you're all required to renew your password once a year. If you're locked out, you're not able to access, you can click on forgot password and be able to log in by resetting your password. If you're still not able to log in, please feel free to reach out to me. I can help reset your password for you, especially if you forgot your security question. We can reset it for you. Either call me or call broker services. I definitely be able to help you with that. All right. So as you hover, this is the view. As you hover over to the left, these icons here, they're going to give you various options available, including such as looking up your book of business. And when you look up your book of business. This is what it looks like. It's pretty much a blank page. You need to hit search in order to retrieve your entire, you do nothing but hit search. It's going to retrieve your entire book of business, including active and terminated members. And this is where you go to also renew your book of business. Molina Broker Services is located in Utah, so they're open Monday through Friday, Mountain Standard Time from 7 a.m. to 6 p.m. During open enrollment, we do open extended hours, including some Saturday weekend hours. So that information is going to be sent directly via e-blast to all agents. So broker services is option one. They will help you. Their email is here for you, help you with general inquiries such as account access issues, member evidence of coverage, summary of benefits type of questions. Broker care team is option two for member access to care issues, billing discrepancies, or termination in error. You may also email them. Commissions team will help you with reconciling your book of business or missing or unpaid policies. The contracting team is option four. They will help with appointment-related questions, E&O, licensure, and if you need to update your contact information. Molina has unique member services numbers. So for Ohio, which is state-based, state-specific. So you want to call the 888-296-7677 for Ohio. And if you have clients in any of these other states, you want to make sure you give your clients the member services number. Now, for any urgent situations when you need escalated, you need these issues escalated, definitely feel free to reach out to me instead of giving broker services a number to your clients. Reach out to me and I'll help, or send me an email. I'll help with escalating specific issues that you need assistance with.
Fantastic.
Now, I am your representative for Kentucky, Michigan, and Ohio. This is a list of my counterparts that represent Molina in other states. I'll make this available to you as well when I send this out. This is the end of my presentation.
Fantastic.
Thank you for your time this morning. I'll be more than happy to answer your questions.
Great, Kahassai. Thank you so much. And as many of you have already done, please put a question in the question box, and we'll roll through those right now. And got so many great brokers on the call today. This has been a full house. Really great participation today. First question is, Genesis Healthcare was listed as a hospital for Muskingum County residents, or actually was not. So Genesis Healthcare didn't appear on that list.
Yes, on this is an old slide that I have not updated it. Yes, that is correct. Genesis Hospital is in network. I will be making an update this prior to sending it. Yes, Genesis Hospital is as a result of Genesis County being a new county this year. They are part of our network, and I'll be sure to add that prior to sending you a copy of this.
Fantastic. And a point of emphasis is when you guys are looking up providers, you can use healthcare.gov, but always revert to the Molina provider list because that's the ultimate authority.
That is correct.
Healthcare.gov doesn't always update stuff. So as a point of emphasis, always look on the Molina site for that. So next question is, will this slide deck, or at least the Silver 1 comparison with Silver 8, be sent to us?
Yes.
Okay, fantastic.
We'll send a copy of the entire what I went over covered today. I'll just make sure to add Genesee to that list.
Okay, great. By all means, if you have any questions, just put them in the question box. We got a couple more for you. Are members going to be receiving the renewal October 1st or November 1st, or when exactly will they be doing that?
Renewal communications will start being sent starting the first week of October to members.
Okay.
And renewal of your book of business will be ready for renewal if you choose to actively renew through View and in your broker portal.
Okay, great. And guys, if you need any help accessing that, just reach out to me or Kahassai, and we'll get you pointed in the right direction. Next question. Molina members cannot go to other Molina states for routine care. Is that correct? Is that crossing state lines?
That is correct. If they happen to be traveling and they have an emergency, they certainly have access to any hospital if it's a true emergency. Now, there is a real concern as far as balance billing, because Molina is going to pay that out-of-network hospital similar to how we would pay an in-network hospital. And that out-of-network, a lot of times in emergency, they may balance bill the member if they don't feel what we paid them was sufficient. But our members also have access to teledoc, in which they could be anywhere. This is free access, unlimited, in which they can get access to telehealth and get a prescription from any CVS anywhere in the States.
Okay. All right. Next question, are we able to capture the premium payment right after completing a marketplace application? We thought that was an issue last year. So premium payment.
Yeah, premium payment, I don't remember that being an issue. That hasn't come to my attention, but yeah, when you complete an application using Health Sherpa, there's going to be a pay now option, and it's going to take you directly to route you to the payment system. And certainly you can pay a one-time payment, just that initial payment, or you could set up recurring payment if you have authorization from your client to do so.
Okay.
And that should not be an issue.
Okay.
And a couple of years ago, we did have that.
Yeah. Fantastic. Good questions, as always.
Yes.
We are the best brokers in the business. And we'll just wrap things up right now. We'll get a copy of that presentation shortly. This recording will be out on our resource center, so you can review this at your leisure at another time. And with that, we'll conclude the presentation. Thank you so much, Kahassai. Everybody, have a great day.
All right. Thanks, everyone. Appreciate it.